Hi, welcome to welcome to Iron Health Talk with Dr. Akram. I am Akram. In this program, we'll be talking about all kinds of different health issues with different experts in the field. But today, we will be talking about kidney stones and urinary tract infection. So, sit back, relax, and enjoy your time with us. Between 1 to 15% of people globally are affected by kidney stones at some point in their lives. In 2015, 22.1 million cases occurred, resulting in about 16,000 deaths. They have become more common in the Western world since 1970s. Generally, more men are affected than women. Kidney stones affect all geographical, cultural, racial groups. The lifetime risk is about 10 to 15% in the developed world, but can be as high as 20 to 25% in the Middle East. Kidney stones have affected humans throughout history, with description of surgery to remove them dating back to 600 BC. The existence of kidney stones was first recorded thousands of years ago, and the lithotomy for the removal of stones is one of the earliest known surgical procedures. In 1901, a stone discovered in the pelvis of an ancient Egyptian mummy was dated back to 4800 before Christ. Kidney stones didn't even spare the famous and the celebrities. Napoleon I, Napoleon III, Peter the Great, Benjamin Franklin, Isaac Newton, and William Harvey were the few examples who were known to be affected by kidney stones. Genetics, environmental factors, obesity, certain foods, medications, and not drinking enough fluid also can be the contributing factors to the stone formation in kidney. At the same time, about 150 million people develop urinary tract infection in a given year. They are more common in women than men. Up to 10% of women have a urinary tract infection in a given year, and half of women have at least one infection at some point in their lifetime. Urinary tract infection is also not new to our world. It has been described since ancient time, with the first documented description in the Urbis papyrus dated back to 1550 before Christ. Even though these two conditions have been with us for thousands of years, we still couldn't eradicate or halt its progression. Is it nature's fault or our misunderstanding of the nature? Let's make ourselves clear of these two conditions today, so we can take actions to prevent it happening to us or our loved ones. Let's welcome our special guest in our program, Mr. Sam Datta, who is a consultant urologist, and also welcome Miss Kerry Bliss, who is a clinical nurse specialist in urology. Sam, it's nice to have you in our program.
Thank you.
How are you today?
I'm good. Thank you very much for inviting us here.
Thank you very much for being here. Kerry, it's amazing you're here.
Thank you, Akram.
How are you feeling today?
Yeah, it's good to be here. It's good to be part of this.
Okay, good. Before we talk about stones, let's talk about ourselves first. Sam, who are you? What do you do generally?
So I'm a consultant urological surgeon. I work in Essex, and one of my specialist areas is stones and endourology and the treatment of kidney stones. So it's something I see quite frequently, and we see a lot of patients throughout the year with kidney stones and urinary tract infections. And I work in a big team with Miss Kerry Bliss here. I enjoy my time. I play a bit of cricket occasionally, and I enjoy my badminton as well. So I try and keep as fit as possible, as you say, trying to prevent and ward off illness in difficult times.
Okay, so when you play cricket, I think you should drink a lot of water, isn't it? Prevent
Absolutely,
stones. Okay.
Absolutely.
We'll talk about it a bit later, Kerry. Okay, what do you do? Like what?
So I've been a nurse for around 10 years. I specialised in urology around 4 years ago. I kind of fell into it a bit by chance because of my family circumstances at the time, but it couldn't have been a better chance. I work in a really supportive team with Mr Datta, and I'm learning new things every day.
Okay, how do you find to work with these all these surgeons and other doctors and other people? How do you manage it?
The urology surgeons are fantastic. They're very open, and you can easily go to them for support and advice. So yeah.
So anyway, so we all are here to look after the patients, isn't it?
Definitely.
That's the goal, anyway. Okay, that's good. Okay, how common is this kidney stone, Sam?
Kidney stones are quite common, actually. Certainly in the Western world, you mentioned a figure of between 10 and 15%, and that would play out. There's certain areas in the world where kidney stones are more common, as you say, the Middle East, where it's hot and dry environments. Some areas in Pakistan and India and Bangladesh where it can be very hot, and the diet is the climate is hot and dry, and the diet is particularly either meat-based and there's not enough water being taken in with the diet. So it is quite a common condition. Certainly here in the Western world, we see it quite frequently. You see patients come along every day with stone-related emergencies.
Stone-related emergencies, isn't it? That's right, yeah. Anyway, this is a live program, so call us on 0203 515 5788 if you have any questions or suggestions, or write to us healthtalk@intv.co.uk, and you can also follow us on Twitter, Facebook, Iron Health Talk with Dr. Akram, and our dedicated YouTube channel Health Talk with Dr. Akram, and of course you can watch us on Facebook Live, intv.co.uk. Okay, let's go back. Who gets these stones?
Stones, as you say, is more. It's slightly more prevalent in men, although women and men and children and older people do suffer with stones.
Okay, yeah. Who gets it?
Kidney stones can happen in all ages. It tends to be more prevalent in men. And we see patients who have slightly higher BMIs or more protein or meat-based diet. Or patients with urate stones. The most common stones are the calcium oxalate stones that we
calcium oxalate stones.
That's the most 80 to 85% of stones, we'd say.
So where does this calcium come from?
The calcium can come from the diet. It can come from the body with itself, right? The patients can often have history or family history of stone formation, and it's a combination of multiple factors. There's no particular gene that causes you to have stones.
So there is no particular gene which says you have a stone?
No, there are very rare conditions where particular genes can be involved, like cystinuria, but these are very rare causes of Kerry, what would you say is a lot of stone formers? Any particular types of patients that you tend to see?
No, I think it's a mix. It's a mix of ages.
Yeah.
And I think where we are in Essex, we see a mix of both sexes quite equally.
Yeah.
Are there any part of England where they have more stones and less stones?
Actually, we're in a hot spot of stones. So if you did a heat map of admissions or treatments for stones, certainly in Essex and in the Tendring Peninsula particularly, is a particular hot spot for stone treatments. And so we're very lucky to be able to practice and serve our patients in the area where we are. But certainly there are areas throughout Britain that have high areas of stone formation, and certainly in the world, Saudi Arabia is one of the highest, as you say, up to 25%.
Saudi Arabia is
Arabia's got one of the highest.
Is it because of their diet and drinking less water?
Combination of climate, diet, as you say, body mass index. And drinking water and keeping well hydrated.
Yeah.
Would you say that was the case?
Yeah, I think so. Definitely the hydration.
Yeah. So what do you generally advise for them? Like, first instance, if somebody comes to you with a stone, what do you tell them?
Drink lots of water.
Drink lots of water.
Yes. For stone prevention, definitely.
Water,
yes.
That's the main thing.
Yeah, there's a little bit of evidence of having lime or lemon in your diet to help prevent it. But essentially, it depends on what age to present with. Because if you present at a very young age, you may be a high-risk stone former. Or there are certain factors that may influence whether you form stones recurrently. Most people, 50% of stone formers may not ever form another stone again, or may form a stone 10 or 15 years later. So not a very high risk. So it depends what risk category that a patient falls into.
Okay, so what kind of age they start the stones?
Generally, it happens 30 onwards. 30 to 60 is the kind of the age group that patients come. But we do see patients.
Yeah,
who are
we
younger.
do, and we quite often get patients who have stones and they're found incidentally, and potentially they've had them for a long time, and they don't know about it.
And they don't know about it, and they may have had a scan or by a CT scan or an ultrasound scan, which brings it to light. So
that's true as well, isn't it? The small stones, they don't get noticed. They pass, isn't it?
Yeah.
Very small stones can be, and there have been studies looking at patients who have had scans for other reasons and have incidental small stones up to 3 or 4 millimeters.
Yeah. But some people it causes pain, and that's the time they seek medical help. Isn't it?
Absolutely. Kerry could tell you a bit more of the symptoms of what generally do you see as the symptoms of presentation.
So we see a lot of patients coming into the hospital as emergency admissions with colic pain. So they have pain in their loin.
1 second, Kerry. There's a caller. Let's join the caller as well, and we'll continue our talk.
Yeah.
Hello, welcome to Health Talk. Hello.
Hello, yes. Actually,
what's your name, sir?
My name is Jahid. I'm calling from London.
Oh, you're calling from London. Okay, excellent. Go ahead with your question, sir.
Yes, actually, I'm suffering kidney stone nearly 20 years, and I have 3 times direct operation, which is through camera. They make me bleed, and they crush the stone. It happened 3 times. Like every 2-3 years, it develops, and then they do the operation. So 3 times they done, and they done so many times with the ray operation. Just with the ray. But I don't know. It come back again and again. Every 2.5 years, 2 years, and I drink lot of water all the time, but it's not helping me. So I don't know if you suggest anything. Still I'm under frequent. Still I'm under hospital UCLA.
Thank you very much. So that's a very interesting call. Sam.
So it sounds like you, from the description, that you produce stones every couple of years.
Yeah.
You've had lithotripsy, which is the shock waves that we talk about, multiple sessions of lithotripsy, which is one of the treatments for stones. And you've also described stone treatment surgery. So the kind of 3 most common treatments are the lithotripsy, the flexible ureteroscopy, and where they go in with a camera called percutaneous surgery, PCNL surgery. So those are the 3 most common surgery that you kindly described. If you are forming recurrent stones, and for this patient, certainly we would recommend a 24-hour urine analysis, checking the blood test for calcium and urate to see if there's anything we can alter to prevent the patient coming back with further stone formation. And there is some evidence that you can measure the 24-hour urine and see if there's any risk factors. Also, one has to look at the diet and also check the urine pH as well. These are the most common things.
These are the most common things, isn't it? Okay, sir. Are you happy with the answer? I think the caller is dropped, but he says listening to us anyway, so that's good. Thank you very much. Kerry, sorry, let's go ahead.
So yeah, patients present to the accident and emergency department with colic, so where they've had a stone that's come out of the kidney and dropped into the ureter, so the pipe that goes down from the kidney to the bladder, and they get severe pain going down from the kidney down into the groin and vomiting.
So the pain starts from the back, isn't it? And it goes to the groin.
Yes, yeah,
exactly.
very common for it to come down.
Is it typical pain? Is it? Can you like?
I've never experienced it, but patients who have experienced it say if they get it again, they know exactly what it is.
Exactly what it is.
Yeah.
It's an unremitting, unrelenting pain, and it's spasmodic, and patients you see doubled up often, in severe pain, requiring lots of painkillers and pain.
Yeah, that's actually when I was reading. I'm not a urologist. I was reading a lot about this program, and then I realized that apparently these stones are really painful when it's in the ureter, isn't it?
Yes, incredibly painful. We see. I mean, Kerry, you see quite a few, and when you an acute. The 3 main presentations are that severe pain, which almost invariably they come to hospital with. Patients present with sometimes with blood in the urine, or blood, they see it in the urine or on dipstick. And the other presentation is recurrent urinary tract infections.
Urinary tract. We will be talking about urinary tract infection as well a bit later in the program. Anyway, let's talk a little bit about diet. So let's give them an idea what kind of diet forms stones and things like that.
So it's interesting. People assume that because the stones are made of calcium, everyone should reduce their calcium. Now there is a certain limit where about 1,000 milligrams per day, which is a normal calcium. If you have too little calcium, you can produce stones, and if you have too much calcium, you can produce stones. So
that's interesting.
It's an interesting. Everyone assumes that you must reduce your calcium straight down. There are certain if you eat a lot of animal or fish or protein in your diet, that particularly fish, red meat, that can raise your urate levels. And as people become bigger, and we see in Western world societies patients getting high body mass indexes, that can predispose to stones. And we know things with high oxalate levels like spinach, nuts, certain food items have high oxalate levels, they can predispose to stone formation.
So these ones, do you like? It's a bit confusion even for me now. So what food can we eat when we take it? But I think this is more precautions for somebody who has stones already. Isn't it?
Correct.
Yeah, and if they know what the stone is made of.
Exactly. So they can go and check what the stone, and they can prevent it. It's not for the general public. They can eat normal amount of meat and normal amount.
Yeah. Like anything, it's keeping a healthy, balanced diet, which is nutritious, not over, but over protein or too many fizzy drinks or caffeinated drinks.
So Kerry, drinking water, how much? A glass, 2 glasses? Or how much is supposed to drink?
So we advise patients, if they've not got any problems with heart failure or with renal failure where they've been told that they have to restrict the amount of fluid they have, that they should have between 2 and 3 litres of water a day. Ideally that's water or diluted squash, and we say to avoid fizzy drinks or drinks that have a high sugar concentrate in them.
So the fizzy drinks like Coca-Cola, Fanta is not advisable?
Not advisable,
stones.
No.
What about beer?
Yeah, beer's okay.
Beer is good, yeah. Not wine?
No, I think wine's okay.
Wine's okay?
Everything, I think it's in moderation.
Yeah,
it's in moderation. Like anything, if you have too much of anything, I think it can cause trouble.
Yeah.
Right? Yeah.
So yeah, that's good. So, but I think they say about spirits dry you off, isn't it? Or you have to drink water with spirits, like if you drink whiskey or something.
Yeah, so if you have 1 whiskey, you should have 1 glass of water with it.
Oh, so 1 whiskey, 1 glass of water.
Yeah.
That's a good point, yeah. But beer is fine, yeah, okay. But don't get drunk, of course. That's good. Let's talk about Sam's genetic factors. We talk a little bit, but are there any genetic... does it run in the family or something like that?
Yeah, there is. If you have a strong history of stone disease, and it may skip a generation or not, certainly you can be affected by that. There haven't been a specific isolation unless you have a certain condition. There isn't a specific gene that's been highlighted to cause stone disease, but we know that genetic factors certainly play a part.
Isn't it? So I cannot say that if my father had stones, and I will have stones.
Not necessarily, because you're always, you're going to be half your mother, half your father.
Half your father.
And it's how that mix is, right? So that isn't always the case, but often we see when we take a history of patients who present, they'll say, look, my grandfather had stones, or my father had stones, and I'm getting more stones. So it's one of the factors that we take. But
again, if they're living in the same household, their food must be same as well, isn't it?
Yes.
Their food habits and drinking water, they all come as a family, isn't it?
Correct. But not necessarily every member, although they might, a husband, wife, children will be having the same food, not everyone will have that risk as such.
Superimposed infection, kidney infection, how common is it?
So we see a lot of patients in clinic with recurrent urinary tract infections. Predominantly they're female. Females are more prone to infections because, and that's because the urethra, so the tube that takes urine from the bladder to outside of the body, is much shorter in women. So there's a higher risk of bacteria getting into the bladder. So the bacteria
going up.
That's it.
Trekking up, isn't
it?
So that's the reason, isn't it? But anyway, the urine infection is not. It's not always with the stones, isn't it? The urine infection can happen most of the time without stones, especially in ladies.
Yeah.
Is there any part of the period, like during the pregnancy, infections goes up, or any young age, or anything?
We see a lot of older women with recurrent urinary tract infections.
Older women, that's right.
And that can be due to the levels of estrogen in their body changing because they get lower. So natural vaginal secretions decrease.
Oh, right.
So that is another risk factor for bacteria getting into the bladder.
What kind of signs and symptoms they present like when they come to you? How do you know that they have urine infection?
Mainly,
especially if you could tell our public and how they could keep an eye on it.
so if you have pain when you're passing urine, that could be a sign of infection. If you're having to pass urine frequently, so you're in and out of the toilet and only passing small amounts of urine. If it's very urgent when you need to go to the toilet and you have to get in there quickly, or if you see blood in the urine, they can all be signs of infection.
So in that case, what they need to do?
See a doctor.
They can go to the GP. So
yeah, the GP in the first instance. Yeah, GP in the first instance to have the urine checked.
So this is not really urgent, so they have enough time to play around.
Yes.
Okay, that's good. So how to prevent this urinary tract infection? What can you do for that?
Well,
any advice you give for these our viewers or ladies who are watching?
Well, one thing that we always say in urology is drinking lots of fluid again.
Fluid?
Yes, because if there's bacteria in the bladder and you're drinking lots of fluid, then you'll flush it out.
That's the point there, isn't it? It's not the water goes and desensitize or whatever these bacteria, but the more water it flush it out, isn't it?
Yes.
It cleans.
Yeah.
Water is really good. So a lot of water. So let's come. So if a normal person, how many liters they should drink a day?
2 to 3 litres?
Yeah, I would say about 2.5 to 3 litres.
Yeah.
A normal person.
2.5 to 3 litres, isn't
yeah.
it?
Depending.
Well, make them go to the loo about 4 or 5 times a day.
So we say up to normal would be about 8 times a day. 8 times a day can be normal, but it depends what your body rhythm is like. And some people would be 4 is normal, some would say 8.
Okay. What kind of treatment we have for this urinary tract infection, actually?
Yeah, like with any medical interventions, you don't always need to intervene. But with stones, if particular stones are very small, they don't necessarily always need treatment. Sometimes when stones tend to get to 4 or 5 millimeters or give rise to symptoms such as bleeding, infections, or pain, those are areas where patients often seek treatments or present as emergencies. And the treatments generally
Sam,
offered.
I'm going to hold you. There's a caller coming. Let's join the caller as well.
Sure.
Hello.
Hello, good evening.
Good evening, sir. What's your name, please?
Do you need my name?
That's fine. You can go ahead if you don't like. Yeah. Okay. Where are you calling from?
Yeah, I'm calling from Bath.
Oh, Bath. Oh, excellent. Thank you very much. Okay, so go ahead, please. Yeah.
I am 70 plus, 74, and I had some symptoms. Occasionally, I took urine samples to my GP, and I felt a bit uneasy. I thought I might have UTI problem. And GP got annoyed. He said, and it seems you are coming again and again. You don't have any back problem or any other symptoms. Anyway, recently I started having back pain on the right side. I feel pain on the pelvic bone, and I don't feel that problem with the urine. Occasionally I feel a bit smelly. So I thought whether I should get worried about it.
Okay, sir. So you have pain on the pelvic bone?
Yeah, it's, for the last 3 to 4 weeks.
Yeah.
I thought I did something, I damaged my back, but so far I remember there is no click or anything on the bone or in the back.
Yeah.
So as if it came from nowhere.
Okay, so thank you. Yeah, that's fine. To make it clear, do you want to ask him a few more questions to clarify?
Yeah, I mean, is there any has the pain been there a couple of weeks, or is it getting worse, or have you had any blood in the urine or problems with urination apart from the UTI that you suffered with, sir?
I think probably he didn't realize he dropped the call.
He dropped the call.
But anyway, you could answer for...
So someone who is getting recurrent UTI.
Recurrent
so
UTI.
This gentleman complained of pain.
Yeah.
He complains of pain on one particular side in the pelvic bone.
Yeah.
He complains of a urinary tract infection. So a urinary tract infection in a man is usually investigated because it's not really normal. We tend to, if a patient keeps coming back with urinary tract infections, there's usually a cause for it. And we investigate them by generally starting with a history and examining examination. We would examine the prostate, we would book possibly an ultrasound scan. Certainly in secondary care, we would arrange for a look-in with a telescope, a feel of the prostate. Often people worry about if the prostate is abnormal or the PSA could be high. Now, a urine infection can raise the blood hormone. Now, the PSA test is a blood test that patients have, and it is a marker of the prostate. But it doesn't necessarily always go up because of prostate cancer, which most people worry about. And it can go up with urine infections, it can go up with a benign prostate, and it can go up with prostatitis. We often see patients that are referred to us who actually the PSA levels comes down, and that's why it's so important to measure it a couple of times. What do you think, Kerry, about? And what sort of investigations would we do in secondary care for these sort of patients? You see a lot of them for investigation.
Yeah, so we would check that they're emptying their bladder properly. So we would get them to do a flow rate.
Emptying the bladder, yeah?
Yes.
Okay.
So we get them to do a flow rate, and that checks how good their flow of urine is, and then we scan their bladder to see if there's anything left in there
scan
afterwards.
the bladder, yeah?
Yes. And depending on that will depend on if there's other investigations needed. So if the bladder isn't emptying properly, then the doctors may ask for a test called urodynamics. So that looks at the muscle that surrounds the bladder and if it's working properly.
So urodynamics, the third one, say.
Yeah.
So this gentleman mentioned that he had a urinary tract infection and had pain going up the side towards the pelvic bone. So the differential diagnosis, or what people think about, essentially, has this gentleman got something like pyelonephritis?
Yes.
Or has he got a stone that's
pyelonephritis is an infection.
It's an infection, and often the infection starts in the bladder and can work up to the kidney.
Kidney, yes.
And that's one of the things. But you know, he's clearly gone to the general practitioner, and that's one of the things that one would rule out by sending a urine sample. And especially if the patient keeps coming back, one would instigate some sort of investigations.
As it looked like, he might need some input from specialists.
He may do, yeah. If it's recurrent and you know, the problem isn't going away, and an ultrasound scan would be a good test to start with, and a dipstick of the urine and sending a culture would be a good test to start with.
A culture as well. That's a good. There's a lot to do, isn't it? For especially when a gentleman comes with this age and he's got these problems, it's recurrent. Yeah. So. Probably, I think he can go back to the GP and ask for his advice to be referred to the specialist.
If needed, yeah. If the general practitioners usually see this quite commonly, and especially someone who's having recurrent problems, you know, they would start the first stage of investigations, and if needed, refer onwards.
Yeah, that's great. Okay, there's another call online. Hello?
Just called earlier.
Okay, sir,
The doctor wanted me some questions.
Okay, fine, yeah.
Yes,
please go ahead.
Yes, sir. Is the pain around the back, or is it around the front of the pelvis, or is it
It's on the right back and a bit on the side.
A bit right back on the side. So what are the kind of, we talked about whether it may be an infection of the kidney or it may be a stone, because all of these things can give rise to urinary tract infections. So it may be wise visiting your general practitioner and asking a few questions, just saying that, you know, I keep getting the symptoms, and maybe an ultrasound or a urine test just to check if there's any bacteria, or an ultrasound just to be reassured. And also, in a man who's having recurrent urinary tract infections, an examination of the prostate may be appropriate as well, and some blood tests. Those are generally what you know, we see commonly performed in the community.
So I also feel that my the bladder is not emptying properly.
Yeah.
And that again
would come up on the ultrasound scan. So when they do a scan, they can get you to empty your bladder and then do a scan to see how much is left over. And that will give us an indication if the prostate or any other structure is causing some blockage or obstruction. So it's a marker, and we tend to do flow tests as well, Kerry. And it's a non-invasive test.
It's very simple.
Yeah.
So Bath is so your local hospital must be Bath Hospital, isn't it?
Yeah, Royal United Hospital.
Yeah.
Yeah.
Okay, so are you happy?
Okay, thank you very much.
Thank you very much for being with us. Thank you. Thank you. Oh, let's go ahead, Kerry. For urinary tract infection, do you straight away treat them, or are there anything you do straight away?
So if the patient has symptoms of the infection, so as we were talking about the pain or frequency to pass urine, what we would do initially is to dip the urine to see if it shows signs of infection.
So you'd have to look for the signs of infections?
Yes. So if there's signs of infections and they have symptoms, then we would start them on a course of antibiotics. And we would then send the urine to the laboratory to be checked so we can find out exactly what bacteria is growing and if we need to change the antibiotics specific to that infection.
But certain bacteria are quite common, isn't it? It's in the urinary tract, so there are lots of bacteria.
Yes.
Some of them are normal flora, isn't it?
Yes, there's normal flora, but if people can have bacteria in their urine and can be asymptomatic, so not have any symptoms. And in those cases we wouldn't treat it.
You wouldn't treat it.
Yeah,
that's right. Okay, that's good. Sam, let's talk a little bit about the formation, the mechanism, how these stones they
This
form.
is an area that a lot of researchers...
While you're talking, we're going to prepare a video as well. This video will show basically about the mechanism and how the stones formation. So let them get ready and let's talk about it.
So essentially you can get an injury in the kidney or an area in the kidney which starts a nidus, which is like a starting crystal, almost like a small crystal.
Small crystal, yeah.
And the crystals form around it, and they can form in two areas. In areas in the kidney called the papilla or underneath the papilla, and these are areas that are undergoing active research. So the answer isn't completely clear, but essentially calcium deposits and oxalate form on these areas, and they get bigger and bigger over time, and it might be over a few years. If patients have high risk factors, often this can be over a shorter period of time. And essentially as the stone gets bigger, it essentially drops off, and then when it drops off and it enters the ureter, which is the pipe coming down from the kidney to the bladder, then it can give rise to pain or blockage.
So that's the time the pain starts, isn't it?
That is the
Once
time.
in the kidney on the top.
Usually
you don't
in
have
the
pain.
kidney, unless it's bobbing in and out of the pipe, right? It doesn't tend to give symptoms. But once it starts trying to move into the pipe or sitting just outside the pipe, it can give rise to pain and symptoms.
So that's the time the people suspect and they come to you.
Yeah, and they often complain of pain around the sides on the flank, right? On the pain on the side of the flank, and they complain of infection and sometimes bleeding.
So what kind of symptoms or signs or what they get at this point?
So symptoms are usually pain, right? Pain in the side. They may get recurrent infections, so they going to the toilet more frequently, more urgently. And super pubic pain, so pain just in the tummy, just in the lower abdomen. That's characteristically where patients
Is it dull
have
pain or a sharp pain? How is
So
it?
the renal colic pain, it can be quite acute. It starts as a dull pain and then really becomes very acute, so much so that you cannot lie still. You are fidgeting around, and if you see someone who presents with acute renal colic, it is quite a profound presentation of pain, and it's unremitting, often unremitting pain that goes on for a period of time.
So the main symptom is pain, then you have the frequency.
Yeah, frequency.
Then, multiple infections.
Multiple infections can happen, and sometimes you can get superimposed infections.
Superimposed infections.
And this is where a stone can cause blockage, and the blockage results in bacteria being present, growing on top of that stone, and until you relieve the blockage, then patients can have trouble, really.
That's exactly. Okay, let's watch this video, kindly presented by the NHS website, and this will explain basically how the stone forms and basically what kind of treatment available in these days.
Kidney stones are hard stone-like lumps that can form in your urine. They are common and occur twice as often in men as women. Let's look inside the body to see how the kidneys work. The kidneys are two bean-shaped organs located near the middle of your back. They work as a filter, removing waste products and excess fluid from the blood, and returning clean blood to the body. The waste products and excess fluid become urine. It travels through two narrow tubes, called the ureters, to the bladder, and leaves the body through the urethra. If there is an imbalance in the waste chemicals in the urine, crystals can form, which may build up into stone-like lumps. These are known as kidney stones. This can happen for a number of reasons, including not drinking enough water, a diet high in protein, or health conditions such as kidney disease. If kidney stones are small, they usually leave the body when you pass urine. However, larger stones can get stuck in the kidneys or pass down the ureter, causing irritation and blocking the flow of urine. This often results in an infection and intense pain that is felt in your back. Kidney stones can sometimes be treated with fluids and painkillers. However, if infection develops or the urine flow is obstructed, further treatment may be needed. Your doctor will advise the treatment best suited to you. In shockwave therapy, shockwaves of energy are used from outside of the body to break up the stones into small pieces that can be passed out of your body in urine. In percutaneous nephrolithotomy, a small cut is made in your back and a thin telescopic tube is passed into your kidney. The stone is then either removed or broken into smaller pieces using a laser. A ureteroscopy is used if a kidney stone is stuck in your ureter. A thin telescopic tube is passed through your urethra and bladder and into the ureter. The stone is then either removed or broken into pieces with a laser. If none of these methods are suitable, the stone may need to be removed using traditional surgery. If you've had a kidney stone, there is a risk of getting another one at a later stage. Your doctor will be able to advise you on medicines and changes to your diet that can help prevent further stones.
Okay, Kerry, if they have these symptoms, as we said, this back pain and frequency, what they're supposed to do? Can they come to hospital or do they have to call the GP or what's...
If it's severe pain that isn't managed at home, then we would advise them to come to hospital, because if they do have a stone that's in the ureter and is obstructing the kidney, then it's something that we potentially need to deal with as an emergency.
So they need to come to the hospital?
To the hospital, yeah.
When do they call the GP? At what point? Like what kind of symptoms?
So if it's the symptoms of infection where they're having frequency to pass urine or pain when passing urine, or they have a bit of back pain, then they should see the GP.
Then they go through the GP. So it's depend. The problem is same, but how urgent it is.
Yeah, how severe the symptoms are.
How severe the symptoms. Yeah, that's good. So if they come to the let's say the patient's in A&E,
yeah,
and then they come to you, isn't it? Shall we talk about what they do in the urology department?
In the urology department, we generally take a history and examine the patient, see what the causes of pain are, and that's often done after a history and examination is done. They check the urine for blood. 95% of patients who have a stone will have blood in the urine. And that usually prompts a CT scan in the accident emergency department. And the CT scan is very accurate, 99% accurate for picking up a stone in the urinary tract. And that gives you a map of where the stone is and how safe it is to manage that patient. One would check for infection, if there's any infection present, if the patient has a temperature, and whether you can control the pain. The most common painkillers we use are non-steroidal anti-inflammatory, things like ibuprofen or diclofenac, which are medications for pain control. Also, we use paracetamol as well, often IV as pain control. And we can see if the pain is well controlled, there are no signs of infection, the patient's kidney function is good, we can often send the patient home if the stone is small. Yeah, and then we will follow them up with a CT scan. If the stone is on the slightly larger side, we often, as in the video that was showed, we can give shockwave treatments to try and break the stone up within a week or so, to break it up, to make it smaller, to pass out naturally. If patients have lots of pain and the pain is not going away, or it is causing a severe blockage, and we know that the stone is not going to come down, so it's often 8 or 9 millimeter stones, so the stone is not going to, we will then in our hospital try and treat the stone with a laser telescope, so to put the patient to sleep, to do a laser telescope and take
So you
away
pass
the
the
stone.
telescope through
Through the penis or the urethra, and through the bladder to the stone, and try and break it up with a small laser. And that will break up into small fragments, and often we leave a small stent behind, which is a tube to help the ureter heal, or the pipe heal, and that'll be there usually for about a week. And that's generally
that's generally safe, isn't it? Then we have the percutaneous nephrostomy. That's when it's in the kidney, isn't it?
So the nephrostomy. So if someone has an infection, and it's bad, we often put a nephrostomy tube into the kidney that drains the infection away. And then later on, especially with a bigger stone, we would do this percutaneous nephrolithotomy, where we essentially pass a telescope, a keyhole surgery to the kidney, find a stone, and break it up either with a laser or special ultrasound machine that breaks up the stone in the operation. And then we can suck the stone out at the same time.
Excellent.
And it's a very effective way of removing big stones.
So open surgery you don't do anymore, do you?
It's very rare. I will never say never, right? But it is very rare. Certainly in the last 4 or 5 years, I've not done open surgery for stones. It is very rarely done in our units, right?
Usually we could do...
Everything can be done keyhole nowadays, usually. I'll never say never, but yeah.
That's amazing. I think we have covered most of it. Kerry, what would be a take-home message for your viewers?
I think just to stay hydrated, drink lots of fluids, maybe change your lifestyle slightly so that you put things in place to encourage you to drink fluid. So when you get up in the morning, have your tea or coffee like you would normally, but have a glass of water with it, and keep a water bottle with you, because that encourages you and reminds you to keep hydrated.
Sam, about stones, what kind of things they have to look for?
I think the most important thing with stones, the key presentations are infections, especially infections in men, are usually not something that's normal, and you would want to seek advice from your general practitioner. Drink plenty of fluids to prevent stones if you do, and lime in your diet, in your drinks, helps with that. If you do get symptoms of stones, the symptoms to look out for are infection, pain, and bleeding. Those are the key things to look out for. And essentially drink plenty and have a well-balanced diet, and that should keep you away from most doctors, really.
Thank you very much. This is a great program. Even though it's short, but we have somehow managed to give them a brief about these two conditions. That's kidney stones and urinary tract infection. But anyway, if you need to know more about it, you can always go into the websites, and there's a lot in the NHS website, and there are lots of internet website. They provide information for you. But today we talk about kidney stones and UTI. It's an important program, and if you have missed it, you could always go back and watch our program on our Facebook or on our YouTube channel. And for the time being, we're going to say goodbye and look after yourself. But until then, we'll see you in a different program next week. The next week's going to be fracture neck of femur and the treatment for it. This happens a lot, especially when we have a lot of elderly people in our houses, like our parents and grandparents. This is quite common, so keep an eye on for that program. Until then, otherwise, message us on our Facebook, YouTube, Twitter, or Instagram. We'll come back to you with any answers. Look after yourself. Thank you.